Good morning. It's a pleasure to see everybody here this morning. I'd like to welcome the media, the member societies, our affiliate associations, and our friends. Thank you all for joining us this morning. My name is Mona Sarfati. I'm a family physician and the program director of the Medical Society Consortium on Climate and Health. This is the public launch of our group, comprised of 11 medical societies representing 435,000 physicians, over half the doctors in the United States. First, I would like to share with you a brief video.
It was 2011. My son was 9 years old, and he was going to his first band camp. And it was a particularly hot summer. It was actually the hottest July that has ever been recorded in the DC area. It was really brutal. And I got a call that he had arrived in camp, and after standing up for about an hour, he collapsed. I started recognizing that the summers that they were hotter and more uncomfortable were not as I had remembered them when I was a kid. This is the changing climate. As a pediatrician, I feel like this is probably the most critical issue which will affect the future of our children. Plants that are growing are blooming at different times. Insects that can cause illness are coming out at different times in different places. We have to restrict kids more in the summer, and this influences how we care for our patients. I can treat children for their day-to-day illnesses now, but I feel like it's an imperative to do everything I can to protect their future and their health, to preserve for them some of the great joys of living on a planet that's as beautiful and as safe and as bountiful as the one that we've enjoyed.
Today, we begin our efforts to share what we know with the American people about the harmful health effects of climate change and about the beneficial health effects of limiting climate change. Our medical societies have taken the unprecedented step of joining together to educate our patients, the public, and policymakers about this issue. This may seem like an unusual topic for physicians, but climate change has become very real for the health of many of our patients. Today, physicians from different areas of the country will be sharing their firsthand observations and experiences with you. Some of those observations are contained in the report that we are releasing today, Medical Alert: Climate Change is Harming Our Health. You should each have a copy. What you will hear today are just a few personal stories from physicians describing the health effects that they are seeing in their offices. Beyond the stories, there is a rapidly accumulating body of literature about how climate change is harming the health of the American public. These harms will get worse unless we take action. The risk of inaction is simply too great to ignore. Last year, 13 federal agencies, including the NIH and the CDC, conducted a comprehensive review of the effects of climate change on the health of Americans. It found that climate change is harming our health in many ways, directly and indirectly. Yet recent research has shown that few Americans are aware of this. That's why physicians are speaking out today. Beginning today, American physicians are starting a conversation with the public and the nation's leaders about what's really at stake with climate change, our health. Before we get to our speakers, I'd like to communicate a few important points. First, human-caused climate change is happening. 97% of the peer-reviewed papers published by climate scientists agree about this fact, making it abundantly clear. Thousands of studies have proven this. Second, climate change is harming our health now in communities across the nation. These harms include heat-related conditions, chronic illnesses, injuries and deaths from dangerous weather events, diseases spread by mosquitoes and ticks, infections from contaminated food and water, and mental health problems. While the health of any American can be harmed by climate change, some people face greater risk. That includes children, school athletes, pregnant women, the elderly, people with chronic health conditions, and the poor who are most likely to be harmed. Unless we take concerted action, these harms to health are going to get much worse. And the sooner we take action, the more harms we can prevent. The most important action we can take is to increase our use of energy efficiency and speed the inevitable transition to clean, renewable energy. In addition to limiting climate change, accelerating this transition to clean energy will rapidly clean up our air and our water, so everyone can enjoy better health. This consortium is starting to take action today. We will share this alert and this report with the public and with policymakers. We will contact members of Congress, the National Association of Governors, the U.S. Conference of Mayors, and the administration. We're speaking in favor of limiting climate change to the fullest extent possible so that the harm to the health of our patients and others doesn't grow further. Our patients trust us to help safeguard their health. We view this trust in us as a reason to close this gap in public awareness. Beginning with this medical alert report today, we will be closing this gap. We're sounding the alarm. The ultimate danger of climate change is that it's a danger to the health of every American. We're here this morning with representatives from 11 major leading medical societies, including 3 presidents of some of the nation's largest societies. But a couple of instructions before we begin. The hashtag for this topic is #HealthAndClimate. We have a Twitter handle so that you can follow us on Twitter, and that's @DocsForClimate. We'll be taking questions by webcast and in person. Comments and brief personal reflections will also be welcome following the questions. So let's get started. Our first speaker is Dr. Jonathan Patz, Professor and John P. Holton Chair of Health and the Environment and Director of the Global Health Institute at the University of Wisconsin. Dr. Patz.
Mona, thank you very much, Mona. I have researched the links between climate change and health for more than 20 years. From heat waves and storm-related deaths to asthma, from documented longer ragweed seasons or red ozone alert days, and serious illnesses from insect-borne and waterborne diseases. My research, along with many other scientists, show that first, just how many diseases are climate sensitive, and second, that climate change is already harming our health through these many pathways that result in illness and death. The evidence has been accumulating, and synthesis reports have compiled the research findings, including the UN Intergovernmental Panel on Climate Change, or the IPCC, on which I served as a lead author for 15 years, and national climate assessments. I served as the co-chair for the health report of the first U.S. National Climate Assessment to Congress 17 years ago. Yet, most members of the public and policymakers are still unaware of the health risks that they're unaware that health risks sit at the core of scientific concern about climate change and associated extreme weather events. What is new and important about the formation of the Medical Society Consortium on Climate and Health? It's not the medical alert report that they're releasing today, although it is a wonderful and clear statement about the ways that climate change is harming the health of Americans. What is new and important is that 11 of America's largest and most important medical societies have come together to do something. Starting today, they'll be working together to educate the public and policymakers about the health implications of climate change and the health opportunities associated with responding to climate change. This last point is not trivial, considering how a low-carbon economy offers large health benefits from improved air quality and exercise promoting urban planning in the face of rising rates of obesity and related chronic diseases in the U.S. These medical societies, representing over half of all doctors in America, are starting a conversation today, and they are committing to do everything necessary to continue this conversation until the American people and our elected leaders fully understand what's really at stake here: the health of our children, the health of our parents, the health of our neighbors, our own health. And with that, I thank you very much.
Thank you, Dr. Patz. I'd like to turn next to Dr. Nitin Damle, the president of the American College of Physicians and a practicing internist in Wakefield, Rhode Island. Dr. Damle is joining us by Skype due to yesterday's storm.
Thank you, Mona. Yes, I apologize for not being able to be there, but I feel that this is such an important event that I'm really, it's an honor to be here just by Skype if I have to be. And let me say that I'm start off by saying that I'm not just speaking for myself as a physician, but I'm speaking for the 148,000 members of the American College of Physicians who are internists and medical students. We have recently released a policy paper around the health effects of global climate change. I'd like to really restrict my comments to what I see and have seen over the past several years, and that is first-hand increase in the tick-borne illnesses in my area of the country, primarily from Lyme disease, Anaplasma, Ehrlichia, and Babesia infection. In particular, I'm seeing about 4 to 5 cases really per week of Lyme disease in the warmer months, and really extending even into the spring and into the winter season. So we really have seen a asymptotic increase in the incidence of Lyme disease over the past decade or so. Nationally, we report about 350,000 cases per year, and we probably see several thousand cases per year right here in Rhode Island. So, but it's not just Lyme and Ehrlichia and Anaplasma, but it's also other tick-borne illnesses that are really on the rise, and that includes nationally and internationally dengue, chikungunya, Zika virus. So these are other vector-borne diseases, including Eastern equine encephalitis, and we're even possibly going to see the spread of malaria back to at least the Northeast by mid-century, something that we haven't seen since about the 1860s. So in addition to the vector-borne diseases, what we've also seen is a rise in the incidence of waterborne diseases. And it's much more prevalent because of the increase in the number of floods and storms that we see all over the country. There are documented cases of endemic E. coli infections following flooding. Vibrio parahemolyticus actually has been a significant problem in Maryland in the shellfish community. Salmonella, Shigella infections also increase, and we're seeing an increase in parasitic infections from Cryptosporidium, Giardia, and Cyclospora. And as far as viral infections are concerned, we're seeing an increase in noroviruses and Norwalk viruses also. So, but if you take this globally, there's about a billion people in the world who lack safe drinking water, and about 2.5 billion who lack adequate sanitation, and 5 million people in the world, primarily children, die each year of waterborne diseases. So this is a very significant problem and really getting worse. And really, as as Mona and John have said, these effects are really affect mostly our vulnerable populations, but everybody in general. The people with diabetes, the elderly, the people with chronic conditions such as asthma and COPD. And in fact, the WHO predicts that 250,000 deaths per year by 2030 from malaria and dengue and diarrheal disease and heat stress and malnutrition. So that's why I think we need to educate the public and the healthcare community and the media, business leaders, policymakers about these dire effects. And ACP has called not only for education, but really has put in an action plan going forward. So thank you very much.
Thank you very much, Dr. Domley. And I would like to mention that Dr. Domley is one of 3 society presidents who are with us today. I'd like to recognize Dr. Colleen Kraft, who is president of the American Academy of Pediatrics, who's sitting there in the second row. And we're about to hear from the president of the American Congress of Obstetrics and Gynecology, Dr. Tom Gelhaus. So please, go ahead.
Thank you very much. Good morning. My name is Dr. Tom Gelhaus, and I'm the president of the American Congress of Obstetricians and Gynecologists, representing more than 58,000 OBGYNs and partners in women's health. Scientific research shows, and human experience reinforces, that climate change has had a negative impact on the health and well-being of people in the United States and around the world. Just last week, my home state of Iowa was one of many Midwest states hit by a severe storm system. Tornadoes, powerful winds, thunderstorms, and hail caused widespread power outages and toppled trees, causing significant damage to homes, schools, and churches. There were 3 reported injuries in Iowa, and at least a dozen people were hurt in one Missouri city as a result of the same severe weather event. Extreme weather patterns brought on by climate change are causing significant harm to the health of our communities and makes this discussion today particularly timely. Women face some of the greatest risks from climate change over the course of their lives, and especially during pregnancy. In affected regions, climate change puts women at risk of disease, malnutrition, poor mental health, lack of reproductive control, and even death. Additionally, women's exposure to toxic environmental agents during the preconception and prenatal stages can have a profound and lasting effect on obstetrical and later life outcomes, including increased risks of birth defects and childhood cancers. Every day we discover new evidence of how climate change can disturb fetal development. A recent NIH study found that exposure to extreme hot and cold temperatures during pregnancy leads to increased risk of low birth weight in infants. Researchers found that term infants exposed to heat in the 3rd trimester were 31% more likely to weigh less than 5.5 pounds at birth. And infants born to women exposed to atypically hot temperatures during their entire pregnancy were 249% more likely to be of low birth weight. While the connection between climate change and women's health may not be obvious, there are a number of ways it directly impacts women's health. Heavy downpours and flooding mixed with high temperatures can spread bacteria, viruses, and chemicals that lead to contaminated food and water. This results in higher levels of methylmercury in fish and shellfish, a known cause of birth defects. Increased use of pesticides can interfere with the development stages of female reproductive functions, including puberty, menstruation and ovulation, menopause, fertility, and the ability to reproduce multiple offspring. And extreme temperatures fostered increases in the number and geographic range of insects. For example, Zika-carrying mosquitoes have led to more than 1,500 infections in pregnant women across the United States and the District of Columbia, and more than 3,200 infections in Puerto Rico and U.S. territories. Unfortunately, in many cases, underserved, and vulnerable populations are disproportionately affected by the climate change. This includes individuals who live in poverty, lack nutritious food, live in low-quality housing, and are exposed to toxic materials via their occupation. That's why access to health care is so critical. We don't all have to be experts in environmental science, but we all need to support rigorous scientific investigation into the effects of climate change and toxic environmental agents. With evidence to support us, we must be the authoritative voice and help to ensure that the discussion on climate change includes protecting the health and safety of all women and children. Thank you very much.
Thank you very much, Dr. Gelhaus. Next, I'd like to introduce Dr. Robert Byron. Dr. Byron is an internist, and his wife is also a physician, a pediatrician, and they're here from Montana. And we really appreciate the great effort that they went to join us, given the flight delays and cancellations. So, Dr. Byron.
Thank you, Mona. My name is Dr. Robert Byron. I'm a practicing internist in South Central Montana, where I've been for almost 30 years. I'm here to address the day-to-day things that we are seeing in individual patient care. Montana is considered the big sky state with blue skies and wide open spaces, and it very much is. But what we've seen over recent years is a marked increase in wildfires that impacts on individual patients throughout the summer and the fire season. The fire season in Montana has increased by over 2 months in the last 50 years. What used to be the exception now is almost the rule throughout the summer and early fall. We have to caution patients with asthma, chronic obstructive pulmonary disease, or COPD, to not be outside as much. We've seen increases in the amount of medications they need to use, as well as increased likelihood of hospitalization because of flare-ups of their disease. Like I said, this used to be the exception. It's now the rule. And this is a result of climate effects that are becoming increased in our area. Thank you.
Okay, thank you very much, Dr. Byron. Next, I'd like to introduce Dr. Samantha Adut, who's a practicing pediatrician from Virginia and the lead author of the American Academy of Pediatrics policy on climate change.
Good morning. I'm Samantha Adut, and I'm going to be speaking today as a practicing pediatrician about some of my experiences in my practice in Virginia, where I've been practicing for about 14 years. So doctors like myself today are seeing some health conditions appearing outside of their typical location and season. In Virginia, it was 70 degrees on many occasions this February, and spring arrived several weeks early. Early spring means plants start blooming earlier, and with that, the pollen allergy season starts earlier. A few weeks ago, I saw a teenage girl who we have treated for many years for her asthma. She had missed 2 days of school for frequent coughing, wheezing, and chest pain. For years, she has started her allergy medications in March to prevent flaring of her asthma. But this year, the allergies beat her to it. We had to start her medications in February. I don't remember ever doing that before. A longer allergy season has been well documented in the U.S., with northern latitudes experiencing the greatest increase. Early spring and later winter also means ticks and mosquitoes are out and biting for a longer period of time. We are now seeing diseases like Lyme disease, for example, at unusual times of year and in unusual places. Last November, a 6-year-old boy came to my office for a rash. He had just returned from a trip to Chicago, where it had been unseasonably warm, and his mom had found a tick on his chest. This boy had developed Lyme disease. Lyme is now appearing farther north, in places where it used to be too cold for ticks to survive. Doctors in Maine and Canada, for example, have had to learn how to diagnose and treat Lyme, a disease that didn't used to appear in those regions. And it's not just illnesses that are changing. In many ways, kids today are having a different experience of growing up because the climate has changed. And this is not a future possibility. This is today's reality. A few weeks ago in my pediatric office, I walked into an examination room where a father was reading a book about the seasons to his 1-year-old son. He read, "In the winter, there is snow and ice." But then he added, "But sometimes it's hot, like summer." In the recent past, when parents and grandparents like us were children, we would ice skate on frozen ponds in Virginia. Those ponds don't freeze anymore. Our kids today are riding bikes in shorts in February. As a pediatrician, I work every day to use the best available evidence to treat and protect children. Over 97% of climatologists and virtually every single legitimate scientific organization in the world agree that rising greenhouse gas concentrations are warming our planet. Our children deserve the opportunity to raise their own families on a planet that is as safe, as prosperous, and as beautiful as the one that we have enjoyed. We have a moral obligation to act on their behalf. Given our current understanding today, failure to take prompt, substantive action to reduce emissions would be an unprecedented injustice to every current and future child. Through this consortium, doctors are working together to protect our children, parents, grandparents, and future generations. Thank you.
Thank you very much, Dr. Adut. Finally, I'm pleased to welcome Molly Rauch, who's the Policy Director of the Moms Clean Air Force. She'll tell you more about the work and initiatives that they're involved in, but we wanted to include her in today's program so that we would have the patient voice. Parents and patients want to understand the risk to their children.
Thank you. Good morning. Moms Clean Air Force is a national community of over 1 million moms and dads united from across the country in support of clean air and a safe and stable climate. We educate parents, community leaders, and decision makers at the local, state, and national level about air pollution and climate change. One of the many reasons that people join our organization is because of asthma. As any parent of school-aged children understands well, asthma is an epidemic in our country. In my children's elementary school here in DC, the school nurse has an entire wall that's covered with hanging shoe racks, and she uses these shoe racks to organize the asthma inhalers and the treatment plans for the children that she takes care of. And each one of those little shoe-shaped compartments represents a child who sometimes needs medicine in order to breathe. Now, I know that asthma is a complex disease with many causes and triggers, but parents really do want the full picture. And if air pollution makes asthma worse, then we want to know about it. And if climate change makes air pollution worse, we actually really need to know about that in order to be able to take care of our children. I remember about a decade ago, I visited a doctor for some respiratory problems that I was having. I was coughing and short of breath, and I couldn't sleep. I had had bronchitis, but I hadn't been able to feel better even after treatment. And the doctor said I needed an inhaler. I said, "Do I have asthma?" And he said, "I don't know, but this inhaler will make you feel better." And I said, "Well, why am I having these problems?" And he said, "I don't know, but this inhaler will make you feel better." And indeed, the inhaler did bring me relief, and I still use it a couple of times a year. But it took several months before I made the connection between high ozone days in DC, which we experience often, and my symptoms. In other words, my symptoms were worse on high ozone days. And I really wish that doctor had talked to me about that, because I really want to have the full picture. And again, as a parent, it's not just that I want that full picture, but I need it in order to be able to take care of my children. So taking care of my kids means not only doing things like limiting their screen time and making sure they wear their bike helmets. These are things that I can do as an individual in my home. But it also means demanding solutions to climate change. That's a much harder thing, but it's just as important for my children's health and their well-being. And just like healthcare providers should talk to us about screen time and bike helmets, we as parents also want them to talk to us about climate change and the health impacts of fossil fuel consumption. One of the things we've learned from our work with moms across the country is that parents are really hungry for this information. We want to know how climate change impacts our families. We need that information, even if there's no prescription that you can give us that will fix this problem. This is a systemic problem. We need to fix this together. We need policy solutions. We need unified advocacy around this, but that doesn't make it any less important for our children's health. So we want to say today that by launching this consortium and by sharing this kind of information with patients, you're providing the information that we want, and you're helping moms and dads everywhere become better parents. So thank you for that.
Okay, thank you for your leadership and work on this front, Molly. Before we open up to questions, I wanted to quickly share with you a bit more about what we're going to do today. After today's briefing, we're headed to Capitol Hill with these reports, and we're going to visit with members of Congress to share this medical alert and start a conversation. We know that Americans are not aware that climate change is harming our health, and this is the first of many efforts we'll take to reach policymakers on the federal level, the state level, and reach out as well to businesses. We want to communicate and start a conversation about this threat. The consortium is located at George Mason University in Fairfax, Virginia. We're here, we have an office, our membership is growing, and we're eager to talk about the health impacts of climate change. We know that when Americans understand this danger, they want to take action. We want to make sure that voters and policymakers understand that these harms are being felt in every part of this country by all types of people right now. We believe that accelerating the inevitable transition to clean energy and away from dirty fossil fuels will improve our health today and reduce the risks to our health in the years to come. Clean energy is key. With that, I'd like to open up to questions from the room, starting with any reporters or viewers who are online, and I'll direct the questions to the panelists, but anyone can feel free to weigh in from the front table. The same with our society leaders who are seated in the first couple of rows. I'd like to mention also that Dr. Tom Gelhaus has to make a plane, and so again, thank you very much for joining us. Thank you all. Appreciate your being here. Okay, so the first question is, what can patients do about this situation? And I guess I'll direct that to Dr. Adut.
Well, I think on one level, patients can recognize changing threats to their health and take action to protect themselves and their children. For example, heat waves are getting longer and more severe, and parents, particularly parents of student athletes, need to be aware of the risks that rising heat and extreme heat poses to their children. So working with their athletic trainers and coaches to protect children from heat illness is important. Similarly, parents and families need to recognize that the risks of things like tick and insect-borne diseases aren't just when you're hiking in the Rocky Mountains in July, that you can get a tick-borne infection in Chicago in August or November. So being cognizant of those risks, taking steps to protect yourselves, and looking like this patient came to me for this rash, and sure enough, it was Lyme. So being aware of these possibilities is important. And I think on another level, we need patients and families need to start asking their legislators, what are you doing? How are you acting to protect us? What steps are you taking to reduce emissions? What is our community doing to reduce emissions to prevent further warming? So I think that's multiple levels all of which are critical to protecting the health of us today and in the future.
Thank you. Okay. Are there disease threats from climate change that we haven't seen yet? I'll direct that to Dr. Byron.
I think a lot of the disease threats that we are anticipating that Dr. Domley referred to is spread of diseases that to wider areas, particularly from the vectors that carry the diseases, just as we have seen in recent years with the spread of Lyme disease. Zika has multiple reasons for spreading, but climate change may be part of that, as well as other diseases that currently may be called tropical will no longer be tropical.
Thank you very much. There's a question in the room also.
Yeah, hi, it's Steve Barragona with Voice of America. I'm curious, so today we have the EPA is expected to begin the process of rolling back some auto efficiency standards that are part of the previous administration's attempt to limit greenhouse gases. So I'm curious, this is a policy opportunity for you folks. Are you planning to weigh in on this?
Anybody like to respond? Dr. Patz?
So I'd like to go back to when the Clean Air Act was started, and since that time, in 1970, the EPA has been required to do a benefit cost analysis of the Clean Air Act. The benefit to cost is about 30 to 1. And so when we talk about reversing or reversing some of these regulations, it's to our detriment. And I think that this is where we have to be communicating effectively that there are enormous health gains when we have clean air, and these regulations are really important. So to go backwards as far as fuel efficiency, it's not an economic issue alone, it's a health issue. Today, between 60,000 and 80,000 Americans still die prematurely from particulate air pollution. So to roll back these CAFE standards is going to harm our health.
Thank you. Okay, I have a question for Dr. DeNicola. Do you think that the nation's OBGYNs are more acutely aware of health issues caused by climate change, or do we need to be made more aware of this issue? Do they need to be made more aware of this issue? Please join us on the stage. Dr. DeNicola is from the American Congress of Obstetrics and Gynecology, and will sit in for Dr. Gelhaus.
Thank you. First of all doctors in America could be made more aware of the health impacts of climate change, and OBGYNs are included in that group. That said, it is acutely a part of our daily job to take care of the next generation, and as this poses a health risk to that, I think we are seeing it more often in our daily clinical activities than perhaps some other doctors are.
Okay, so there's another question here. How should physicians talk to their patients about climate change? And Molly, would you like to address that since you opened that topic?
Like I was saying, thank you. Like I was saying before, I mean, I think that there are some individual actions that we can take that help protect our families from air pollution, but climate change is not going to be solved with a pill, or we can't shop our way out of this problem. We really do need society-wide action on this. So I do think that part of the message is not just that climate change is causing health harm to our families right here and right now, but that we need to work together for solutions. We know how to solve climate change. The solutions are at hand. It's actually not rocket science. We can do this, but we need to build will at the level of the whole society. And so I really do think that healthcare professionals have a role in making that clear. This is not just an individual issue. This is a society-wide issue. We can do this together.
Thank you. I'd like to direct the next question to Dr. Kraft, who's the president of the American Academy of Pediatrics. And the question is, how can we get pediatricians interested in these issues? The caller says, I've asked my pediatrician about how she feels about air quality, insect-borne diseases, etc. And she said that the day of a pediatrician is overwhelming and overwhelms the ability to use this information in practice.
So I think that it's an important educational opportunity for us at this point in time to be educating our pediatricians. I will tell you that at our annual leadership forum that occurred last weekend, the idea that we need to be practicing and teaching our pediatricians about the health effects of climate change became one of our big notions and our big events. And so the Academy at large recognizes this. And the way that we get this to filter down is to do this through educational venues, through maintenance of certification, through other practice venues as well, too.
Thank you very much. Maintenance of certification is a process that physicians have to go through to maintain their credentials, and that has spread widely and is now embraced by most major medical societies. I think Dr. Domlay also wanted to comment on one of the questions. Is that right? Was I getting a sign that that was the case?
No, I think the speakers adequately covered the area.
Okay, thanks very much. Okay, so another question is, you mentioned certain populations at higher risk due to climate change. Are there certain states and areas that are at higher risk as well? Dr. Patz, maybe you'd like to respond.
Sure. I think that, global climate change, it's really the global climate crisis is a global disruption of the Earth's climate, but the impacts will be felt locally, and depending where you live, the impacts will vary. One of the reasons that I've studied this for so long is I view this as one of the largest environmental public health crises of our time because of the many pathways through which climate affects us, be it from direct heat effects and heat waves in urban centers, ground level smog, ozone red alert days, stagnant air masses and warmer temperatures, to some of the infectious diseases we've talked about, mosquito-borne diseases, waterborne diseases from extremes of the hydrologic cycle, floods and droughts. So, and sea level rise, don't forget sea level rise, from thermal expansion of salt water as well as melting of land-based glaciers. So if you live in Florida, if you live in coastal areas, you're going to have to, be concerned about sea level rise. And I was talking to Dr. Gelhaus about new studies in lowland Asia talking about salination of freshwater aquifers causing preeclampsia, very dangerous condition in pregnant women. So depending where you live, the risk will be different. If you're in the Midwest, there's a real concern for more extensive heat waves. If you live in the Northeast or in Canada, the expansion of Lyme disease. So there is this regional and local texture to the global climate crisis.
Okay, thank you. Another question is about the consortium, and it's now that the consortium is in place, will there be a move to bridge the gap between medical and environmental sectors on addressing this overarching health issue? That's a good question, and I think I can respond to that. We here are 11 medical societies that have come together to send a strong message that climate change is harming the health of Americans and that we have to act now. And we wish to start that conversation, and we are eager to talk to everybody about it. So we will be speaking to the people in environmental organizations. We will be speaking to members of Congress. As I said before, we'll be sending reports and having conversations with other policymakers throughout the country. And we're here. We're eager to talk. We have many societies represented here in the front of the room. There are more that are listed on the back of the report that have been involved in this. And there are even more on our website that have joined since we put together this report. And we know that other associations will be joining us as well. This is spreading, it's growing, and we're very eager to address this to whatever extent and wherever we possibly can. So here's another online question. As a case manager, part of an integrated care team for a free health clinic in Illinois, are there ways to involve all members of the healthcare team? If one of our speakers at the front of the room would like to take this question, you're welcome. Otherwise, I can certainly talk to that. The concept of practicing team care is growing and spreading around the country. More and more physicians are realizing that when they have a team that should be involved in this, and we look forward to seeing that happen to a greater extent. And I'd like to mention that some of our affiliated associations who are here today include people who are other members of the healthcare team, like the National Association of Social Workers. And we're in close touch with the Alliance of Nurses for Healthy Environments. And they have been early observers of the impact of climate change and the importance of paying attention to environmental concerns. And we know that they are with us on this, and we're already working with them, and they are amongst our affiliated organizations. We look forward to working with them to a greater extent. Okay, so can I take a question or two from the room? Are there any questions here that people would like to ask? Okay, yes.
Hi, I'm Ricardo Juarez with the American Psychiatric Association, and Dr. Safford, I just wanted to thank you for the invitation. Dr. Saul Levin, our CEO, medical director, sends his regrets. He wasn't able to make it, but I know he wants to express enthusiasm about this report that's come out from Medical Alert. The APA has been working on pulling together policy, looking at the effects of climate change on mental health, and we definitely have our Committee on Psychiatric Dementias with Disaster and our Council on Research looking on this. So we're definitely following what the consortium is doing and hoping to continue our relationship. Thank you.
It's really a pleasure to hear from you. American Psychiatric Association represents about 60,000 psychiatrists throughout the country. And so we look forward to having them join us as a part of this consortium. We're now a very broad-based coalition of medical societies, and we will get broader over time, and we look forward to welcoming more societies and to spreading educational information for physicians and for physicians to share with their patients and with their communities and with their local policymakers. Yes, Dr. Pass.
I just wanted to respond to that, and thank you for that comment. This is a big area that we want to make sure we don't forget about the mental health consequences of climate change. Some of the obvious direct threats from storm disasters, post-traumatic stress syndrome, forced migration of populations from floods and droughts and sea level rise. But also on the positive side, there are studies out that show that tree canopy and greening cities not only reduce the urban heat island effect and air pollution, but have a significant public health benefit. So there's some important areas here. One other area that we forgot is that workers are also patients. And there's a large growing area showing the effects of extreme heat and in particular on worker safety. There are experiences now with, of course, heat exhaustion and also chronic kidney disease is linked to repeated dehydration. So that's another area of concern, and of course future models show that not only are there the health issues of workers, but also productivity will go down with climate change.
Yeah, thank you very much for that addition. Clearly the health of people who are working outdoors is at risk as the climate changes. Any other questions or comments from the audience or from our panelists? Okay, well then I'd like to thank everybody for coming out this morning. It's really very good to have you all here as we launch this consortium. This is our day of launch, and we look forward to speaking to all of you and working with many of you. Thanks.